The National Senior Citizens Center, in collaboration with the United Nations Department of Economic and Social Affairs, UNDESA, has organized a two-day international workshop on onboarding of auxiliary care agency model in Nigeria, targeted at transforming care and support for older persons into sustainable development. The Director General of NSCC, Dr. Omokaro, disclosed this in Abuja during an interview at the workshop organized to introduce a domiciliary care model and increase focus on senior citizens' welfare despite the significant challenges faced by geriatric care in Nigeria. She noted that the implementation of this new domiciliary care agency in Nigeria will bring a new face to elderly care across the country to provide pronounced support and services for senior citizens.
Is to now come together, look at our policy documents, look at strategic roadmap, look at global best practices, and then localize it in Nigeria. We have brought dignity, professionalism, formality into caregiving. And the beauty of it is that these levels of training has been integrated in the federal government employment scheme. So they can get jobs. So what NSCC is doing is really opening up the geriatric social care subsector.
Similarly, the Permanent Secretary of the Federal Ministry of Humanitarian Affairs and Poverty Alleviation, Abel Eniton, represented by Garba Aganawega, said the ministry is throwing its weight behind NSCC to provide maximum care for older persons in Nigeria. Meanwhile, World Health Organization country representative Dr. Walter Kazadi Molumbo stated that according to statistics by 2050, over 700 million persons would be in the category of older persons, noting that efforts must be addressed towards leaving no one behind in providing maximum coverage on healthcare for older persons in Nigeria. In the same vein, Dr. Robert Veni, Senior Special Affairs Officer from the United Nations headquarters in New York, expressed his profound gratitude to NSCC for the giant strides achieved in line with global best practices.
Very much available